Hello everyone and welcome to the 5th session of NPTEL course in Herbal Drug Technology. In this week, that is week 5, we are seeing different type of interactions that the herbs do with drugs, with foods and with other substances. In this particular session, we are interested in interactions of food. Now, food components can also be treated as herbal materials, plant-based materials or even animal products which contain numerous compounds. Now, these compounds also interact with drugs and other herbal medicine that we consume, and this type of interactions we are going to study in this session. Just to be quick with this, if you remember, the same kind of interactions which occurred between herb and drug can also occur with food, with herb and drug. So same type of interactions can also occur between food and herb or a drug. So which type of interactions, if you recollect, they basically divided into two types: the pharmacokinetic interaction, which had to do with absorption, metabolism, distribution and excretion, as well as pharmacodynamic interactions. This can also happen with food, leading to additive, synergistic, potentiation, antagonism or sometimes unexplained or even adverse effects. Now, food is something which is inevitable. That is, whenever previously we described that you are going to have herb-drug interactions. In that case, either you could do away with the herb or adjust the dose of drug. But now what do we do when we have food interactions? Now, food is inevitable part and we have to consume food, but yes, we need to be aware that these compounds which are present in foods have a complete ability to interact in a way very similar to those we saw in the previous session. So how does food interact? The food drug or food herb interactions can again be classified as pharmacokinetic as well as pharmacodynamic interactions. So when we are talking about pharmacokinetic interactions, these interactions affect absorption, metabolism, distribution as well as excretion. Here, what changes do food do to the absorption? So whenever we are consuming food, there is definite change in pH of your gut, especially stomach. There is change in viscosity, there is change in the content, as well as if you are taking a lot of fluids, there is also change in the volume of fluid in the stomach. Now this impacts the absorption of your drugs as well as absorption of your herbal medicine. Not only that, in a way similar to your herbal medicine, there are certain food components which also have the ability to either inhibit or induce more of this liver cytochrome as well as gut cytochrome enzymes. Now this leads to altered metabolism of these drugs. Coming to distribution, we know that whenever you are having a meal which is more rich in lipids like your oils, butters, fats, there is a good chance that they will dissolve your oil soluble ingredients and they will change the bioavailability of that. Not only that, there are certain food ingredients which are also protein binding, which can affect the protein binding of drug to such substrates, including your albumin. At the end of ADME is your excretion. In this case, if you are taking any purgative or cathartic drug, it can cause a rapid elimination. Same by your diuretic drugs, which can cause rapid urine formation and elimination. Internally, we also have numerous efflux pumps. If you recollect, this include your PGP efflux. So all this mechanism help in rapid elimination. As a result, the residence time is very limited and therefore the effect of this drug decreases. Now coming to the pharmacodynamic interactions, so sometimes we consume food which have some beneficial activity. Say for example, you're eating karela or bitter melon, or for that matter you're consuming something like your methi, that's your fenugreek. We know that these substances have hypoglycemic effect, that is they are going to decrease your blood sugar level. Now in addition to that, imagine if you're taking a drug also which is decreasing your blood sugar level, either the effect will be additive or even synergistic. Similarly, you might consume foods such as coffee or tea which contains caffeine, and we all know that caffeine has CNS stimulant effect. Now combine it with something which is like a sedative. I want to sleep, I am not getting sleep. I'm taking a sedative so that I can get a good sleep. At the same time, I'm drinking coffee. This effects of coffee and those sedatives are going to be antagonistic. Sedatives are going to put me to sleep, coffee is going to wake me up, and therefore there is a good antagonism happening. Not only that, sometimes the other effects of the drug, such as say for example alcohol. Alcohol also is known to affect your coagulation, blood coagulation, leading to blood thinning. Now if the patient is already on blood thinners, there might be increased risk of bleeding when the patient consuming blood thinners also consume alcohols. So these are few examples of pharmacodynamic effects. Let's go on to seeing elaborate examples of the same. So we'll first start with elaborate examples of pharmacokinetic interactions. Here we take a simple case of absorption. Now whenever you are taking, especially in our meal, Indian meal is carbohydrate rich. So we eat lot of carbohydrates, and many of them contains what are called as soluble as well as insoluble fibers. So coming to soluble fibers, this include compounds, or this include ingredients such as acacia gum for making laddus or even tragakanth. We have our gums, jellies which are good rich source of pectins. We eat gummies or even jellies which are agar rich. We also eat bhindi, which is a good source of mucilage, as well as chia seeds. Now what happens is, as such in the plant they don't imbibe water, but the moment they are chewed, they are released from the plant cells and start diffusing into the outer environment. So as a result of our chewing effect, this polymers will go in our stomach, they will slowly open up and form viscous solutions. So much so that it is said that they start lining the gut. Now imagine your gut being lined with a viscous jelly. What is going to happen? Now the absorption of your nutrient is retarded. So they form a barrier to absorption of nutrients, and they form barrier to the absorption of your drugs as well. And as a result, overall, the absorption of your drugs, absorption of herbs, sometimes if you are taking turmeric or you might take any herbal medicine like your licorice, what is going to happen? They are not going to get absorbed because your carbohydrates form a barrier now. So therefore they decrease the environmental they increase the environmental resistance, and as a result their diffusion into the bloodstream decreases and overall absorption decreases. Now coming to drugs such as ketoconazole, they specifically require acidic environment. So if you are taking something like an antacid, ENO, or if you are eating food which is rich in sodium bicarbonate, they are going to alkalize your gut. And if my stomach is in a little neutral or a lesser pH, the bioavailability of my ketoconazole is going to decrease because its absorption decreases. In a similar manner, sometimes we eat or consume food which is high in lipids or fats. Now this is very essential for absorption of drugs which are lipophilic. Now definitely drug show their action, but there are drugs which are extensively lipophilic. In order to be absorbed, it is better that they are solubilized in a lipophilic solvent, and your oils, butters, fats, whatever you are consuming forms a good media for them to dissolve, and thereafter they get absorbed very nicely. So your griseofulvin or even your lumefantrine are examples of some drugs which are increasingly bioavailable when you have a very lipid rich diet. On the contrary, for people those who are cutting fats, oils from their diet, imagine these drugs, they will not be available to this extent as they would be available with a lipid rich diet. On the other hand, there are also some drugs which are affected by food. That means they are chelated or form complexes with the ingredients of food. Such kind of drugs are often prescribed or often told to be administered at least half an hour before the meal so that their bioavailability is not affected and their absorption is good. Now moving on to the next cases, say for example, there are many health conscious people, or there are many people who drink teas without milk. Now here what happens is when you are drinking your tea without milk, the tea polyphenols. Now this tea polyphenols are your flavonoids and tannin derivatives. Now flavonoids and tannin derivatives had a good ability to chelate proteins as well as your metal ions. So when you take your teas with milk, many of the time this tannins and polyphenols chelate with milk proteins and they form colloidal suspension. But if you are having it without milk, now what happens is this tea polyphenols are free. So in this case you can just imagine you having a, I am just giving a very simple case of gallic acid. What is going to happen here is, maybe if I am consuming something which is a metal ion, this metal ion will start chelating with numerous molecules of gallic acid. Now what happens? They form insoluble complexes. And as a result, now because this iron metal is chelated, it is no longer bioavailable. So imagine a patient who is low in hemoglobin, who has been advised to take iron tablets, and this person is drinking or taking these tablets along with green tea. There is a very little chance that this iron is going to get absorbed because your green tea polyphenols will chelate it. Similarly, you will see that on the other side, there are certain substances which can increase the absorption of iron, and this include the juices of citrus fruits such as your orange. So orange is or even citrus juice is known to increase iron absorption, especially from iron fumarate tablets. If you see, there is also a change in absorption for foods which increase or decrease gastric emptying time. So sometimes when you have heavy meals, especially your non-vegetarian meals, you will see the overall gastric emptying time increases. So in that particular acidic pH, your drug is staying for a prolonged time. Now it is good for acidic drugs that they might get absorbed, but it is not good for drugs which do not want a clear acidic pH for longer duration of time, and their main window of absorption lies not in the stomach but in the intestine where the pH is alkaline. Similarly, when you are drinking milk, it is observed that milk contains numerous metals, calcium, it's a good source of calcium as well as magnesium. This calcium, magnesium metals chelate certain drugs, especially those belonging to tetracycline. So tetracycline form tetracycline calcium complexes, or bisphosphonates also form calcium phosphonate kind of complexes, and as a result they are rendered insoluble. Now when they are rendered insoluble, their bioavailability also decreases. Other factors include your GI volume, more the dissolution. Similarly, in certain disease condition, there will be a lesser absorption. Your bile juices, there are certain drugs which increase the biliary stimulation, especially in Ayurveda. Most of the bitter containing drugs such as your Karela, or a bitter containing drugs such as your Swarshia, they are known to be cholerectic. That means they kind of increase the bile juice secretion. Similarly, there are some enzyme activators and inhibitors for enzymes such as lipases, for enzymes such as peptidases like your pepsin, and also inhibitors of transporters. Now transporters are very vital for absorption. So in your stomach also you have your PGP efflux, which kind of throws back but also transport certain substances or help transport, as well as you have organic anion transport proteins which mostly transport the anionic drugs. Now if this is stopped, the transport of anionic substance is kind of halted there. Now moving to metabolism, the next step. Now metabolism, we saw that the majority effect comes in metabolism of drugs, especially in the liver region. Now liver is known as the detoxifying site in our body, which is responsible for metabolism of most of the xenobiotics or non-biological molecules. Especially we saw in the previous session that the cytochrome family, especially your CYP3A4, is one which was responsible for metabolism for approximately 50% of the drugs. Now it is seen that if you take grapefruit juice or even black mulberry juice, there is a good amount of inhibition observed, especially for your enzyme CYP3A4. Now what is going to happen if almost 50% of my CYP3A4 is inhibited? The drugs which get metabolized by your enzyme, like I said, your drug converting to your metabolite by your enzyme CYP3A4. Now because this grapefruit is kind of inhibiting it, the drug is not getting converted into metabolite, and as a result your drug concentration increases. So it is seen that drugs such as your antihistaminics, cyclosporin, statins, especially with lovastatin, it was seen that the area under curve is like your concentration. So with respect to time, you have your concentration, and as after consuming drugs, this is with respect to time and this is your concentration. So you will see once you consume your drug, with respect to time the concentration goes on increasing, and gradually because of metabolism it decreases. Now this is something which is known as your maximum concentration. Okay. So it is seen that this whole area is classified as area under curve. So because its metabolism didn't happen, it will not go back down easily, it will stay for a longer duration of time. So there it was observed that the 15-fold rise was observed in area under curve of lovastatin, and 10-fold rise was observed in case of tacrolimus. Now this, especially in case of tacrolimus, led to severe headache and nausea. Now pomegranate juice is also one of the important juices which affects the metabolism. It reduces again CYP3A4, and additionally the next very important enzyme it reduces is CYP2C9, which is also important for metabolism of drugs such as busporin, you have your nitridipine, metronidazole, sanquinavir, as well as your sildenafil. So what happens is, if these drugs are inhibited, the concentration of all these drugs is going to be increased because of the inhibition of CYP3A4 as well as CYP2C9. Now moving to few more examples, you will see that pomelo juice also increases the same AUC as well as Cmax. We saw this is concentration, this is concentration, we saw this is concentration, this is time, and what you get is your AUC and this is your Cmax. So both AUC as well as Cmax increased, but at the same time it decreased the time of elimination also, so that's an advantage. Orange juice decreases absorption of one particular drug, and that is alendronate. You need to be careful while consuming this drug with orange juice, because it is seen that consuming orange juice with alendronate decreased its bioavailability by approximately 60%. That's more than half. So you'll need to double the dose of it. Similarly, it was seen that if you see your atenolol, which is used in your heart conditions, AUC of atenolol decreased by about 82% when a person consumes almost a liter of apple juice in a day. But the good part of it was with the clinical trial, it was seen that there was no pharmacodynamic outcome. What does that mean? That there is no change in activity of atenolol which was observed. Now in contradictory to that, the area under curve as well as Cmax of calcium channel blockers was reduced when you administer or when you take it along with the grape juice. So you need to be careful, especially even those who are taking the heart medicines, your beta blockers as well as calcium channel blockers, because people often tend to think that your juice is safe. So we consume or citrus juice, we consume juices of numerous fruits thinking that it is healthy option, and often ignoring the fact that these juices also contain compound which have ability to alter the metabolism of these drugs. Not only the allopathic drugs, it has ability to alter the metabolism of herbal drugs, especially the phytoconstituents of it. Now going to the next case is of distribution. So in pharmacokinetic interactions, when you see distribution, when I am consuming food, this food either can be water rich or it can be lipid rich. Now if it is water rich, it will definitely increase the availability or bioavailability of water soluble compounds by solubilizing them to a greater extent. Now this also depends on its BCS class, if it is readily bioavailable also in addition to soluble. Now for lipid soluble drugs, the solubility becomes a main concern. Now imagine you eating pav bhaji or you eating a very lipid rich diet which is laced with butter and ghee. What is going to happen? Most of your lipid soluble drugs are going to get solubilized in this. So all this oily layer is now rich in drug. So once it gets into your stomach, you have your stomach churning, and due to churning effect, you will see that your drugs get mixed with this oils, your drugs get solubilized in this oil, especially the lipid soluble drugs. Now it is seen that if you see highly lipid soluble drugs with log P greater than 5 with a very high, what you call it as lipophilicity, it is seen that they get entangled into bile secretions. Now this bile secretions form a little micelle like structure called as chylomicrons. Now these chylomicrons are absorbed more efficiently by the lymphatic system rather than your blood. Now definitely your blood circulation is much higher, but once these drugs get into the lymphatic system, despite the slow circulation, they often escape the first pass metabolism. Now because they escape the first pass metabolism, their bioavailability, especially their overall bioavailability, increases, because later on this lymphatic system empties this drug or drains down this drug back to systemic circulation. So it's an advantage. So it's a carrier, slow carrier, but almost a good carrier we can say as compared to your blood by bypassing the first pass effect. So it is seen that for drugs such as your halofantrine, testosterone when complexed with a lipophilic moiety such as your testosterone undecanoate or methyl nortestosterone undecanoate, you will see their bioavailability increasing by lipid rich fruits. Not only that, your foods also alter what are called as carriers. Now in your blood you have lot of lipophilic carriers. This includes your lipoproteins. Now your lipoproteins along with we have in our blood what is called as cholesterol. LDL cholesterol, VLDL cholesterol, HDL cholesterol. Now this lipids often forms association with proteins and are called as lipoproteins. Now many of these drugs which are lipophilic have a good ability to bind to this lipoproteins because they are now lipophilic. They have a lipophilic moiety attached to it. So it is seen that there are foods, and when you consume certain foods, that will alter the composition of your lipoproteins, thereby increasing the binding of drugs, especially lipophilic drugs such as halofantrine, cyclosporin, amiodarone, amphotericin B, which is your antibacterial, nystatin, clozapine, CNS drugs such as haloperidol, as well as anti-cancer drugs such as paclitaxel. Not only that, in your blood, the protein, you remember your albumin, has the ability to bind to many acidic drugs, especially what you can call it as anionic drugs. So changes in your food, when you consume a albumin rich food or protein rich food, that also changes the albumin concentration and the ability to bind to drugs. So this is the way in which your food alters the distribution of your drugs. Now going to excretion, especially when it comes to the excretory metabolism, you will see that the foods which acidify the urine, especially protein rich foods such as your meat, fish, egg and cheese, they kind of produce a very acidic urine, and as a result they'll kind of reduce excretion of salicylates, sulfonamides or even ampicillin. On the other side, when you're having a very alkaline diet, that is vegetarian or vegetable rich diet along with milk, it is said that that can reduce the excretion of compounds such as your amphetamines, theophylline and even antibiotics such as erythromycin. The other class of excretion or excretory molecules which come from drugs such as laxatives, senna, aloe or even castor oil, or even high cellulosic or high fiber diet, they increase the peristaltic movement, and as a result your gut rapidly empties whatever you have consumed. Now since this is rapidly emptied, consumption of such herbs is going to eliminate very quickly whatever you have consumed, including the drugs, including other herbs as well. Now going to some few classical case studies which also need a separate mention. Here is alcohol. Now alcohol is considered as a part of diet, especially in the western countries, but alcohol is known to interact a lot with different herbs. Now it causes really serious interactions with drugs such as opioids, painkillers and sedatives. Now this opioids and sedatives, especially opioids, they bind on mu receptors, sedatives they bind on your GABA receptors, alcohol also bind on these receptors and overall causes what is called as CNS depression. Now this CNS depression also includes the depression of your respiratory what is called as the function. As a result, what is happening is the patient might undergo what is called as respiratory depression, and that might cause death. Now incidences of consuming these medications along with alcohols also increases, like blackouts, and these blackouts can lead to falls, accidents or even deaths. So you need to be very careful while consuming opioid analgesics or even sedatives with alcohol. Now there are certain drugs such as benzodiazepines which are used as sedatives, and you have to be careful while consuming, and they are often contraindicated with alcohol. Similarly, some drugs have sedation as their side effect, especially anti-allergic medicines, antihistaminics. So they should not be mixed with alcohol because that will give you more sedative effect. Now one case is for people, those who are taking paracetamol for fevers, for management of pains. We take a paracetamol and it's very commonly used drug. Now we know that paracetamol over a period of time leads to metabolites which can impair liver function. At the same time, we know that alcohol also impairs liver function. So what is going to happen with these two moieties both impairing liver function? The person who is taking paracetamol also taking alcohol for a long duration of time, that can lead to a severe liver damage. Now in addition to that, drugs like metronidazole can cause typically interactions of disulfiram like which includes increase in your heart rate, vomices or even a throbbing headache. Now the last case, but definitely not the minimal. Now there are certain drugs that causes acidity, when consumed, especially your non-steroidal anti-inflammatory drugs. This includes your ibuprofen, often referred to as brufen, a part of your combiflam, diclofenac, as well as naproxen, taken from people those who suffer from joint pain. Often they are associated with heartburns and acidity, and you know that alcohol aggravates this. So if this is taken, or if these painkillers are taken along with alcohol, there is a good risk of stomach ulcers, even bleeding when taken with alcohol. Now the interactions with alcohol are enormous, so you can even check with the drugs bank. Here I have put the URL and you can see much more kind of interactions. The next set of interactions is with your chai as well as coffee, and that's your caffeine. Now caffeine is metabolized by a cytochrome enzyme called as CYP1A2, and this is CYP is also an important enzyme which metabolizes certain drug agents, especially the psychiatric medicines. Now this interactions or caffeine is known to competitively inhibit this enzyme, and as a result we need to be careful with the substrates of this drug. Now caffeine is known to interact with other psychiatric medicines. Caffeine we know is a CNS stimulant, so imagine taking it with antidepressant, which is also going to cause a CNS stimulant. So it leads to a higher stimulation. Antipsychotic drugs, anti-maniac drugs, anti-anxiety drugs, as well as sedative drugs. So whichever alter the state of CNS, your caffeine is known to interact with them. Now also there are certain stimulants which are found in simple allergic medicines such as your pseudoephedrine. Now caffeine, if you take with such kind of medication, can lead to increase in heart rate, blood pressure, or even restlessness. Now it can also deprive you of sleep. In fact, people take coffee to get that stimulation so that they don't sleep. Now imagine this patient taking a sedative medicine, it's going to kind of antagonize it. Now caffeine is also known to slow blood clotting, thereby increasing the risk of bruising, especially for people those who are on blood thinners, those who are taking anticoagulant as well as antiplatelet medications. Aspirin given for heart patients, clopidogrel, heparin, or even warfarin. Again, you can see your drugs.com to check much interactions, but there are a lot of interesting interactions herein. Now coming to pharmacodynamic interactions, we have a few examples here. Now take for example your vegetables or leafy greens, which are good source of vitamin K. Now you know that vitamin K is good for clotting, so it promotes clotting, whereas people are taking blood thinners where you don't want the blood to clot. So if you are consuming vitamin K rich vegetables and taking your blood thinners, you are kind of antagonizing the effect of both. Similarly, imagine a person who is diabetic. Now diabetic people normally have a tendency to eat food which can reduce their blood sugar, such as your karela, methi. Nowadays they eat your vidania, especially your paneer fool. Now what happens is, if you are consuming all of this all together, cinnamon, what is going to happen? They are going to have an additive effect and sometimes even show synergy. So they might interact with each other as well as they might interact with the anti-diabetic medicine. Not only that, your licorice, which is used as your sweetener in candies as well as in herbal teas, can increase your blood pressure, we saw previously, due to its cortisol or mineralocorticoid-like effect. Now this kind of interactions, when you take licorice candies with your BP medicines, it will lead to antagonism. Your antihypertensives will try to reduce your BP, licorice will try to increase it. Similarly, one more case of interaction is seen with sildenafil or Viagra, which is used for erectile dysfunction. In that case, consuming pomegranate juice is often associated with a lot of pain, and that leads what is called as your priapism. So when one needs to be very careful while taking sildenafil, especially with the pomegranate juice. So all in all, there are numerous interactions which happen with food, and food is inevitable. We have to consume it. It is just the awareness of it will create a better and safer regime, especially for patients taking herb supplements as well as patients taking your allopathic drugs. Here are a few more interesting references if you wish to read more on this topic, and thank you everyone for your patient listening.